lot of things that we have addressed. The pandemic really pushed all of that to the top.
So the COVID pandemic has impacted me in my life as a mother, as a business owner, as just a Black woman trying to make it happen every day, and keeping my business open and my child in school.
I think I started out at the beginning of the pandemic, talking with a variety of our teammates, and we were looking to do some work on the ground and to get some funding for the ground, because we knew that the systems that should be in place and being effective in serving community were not.
Health equity is about how our community or how our society is structured with opportunities so that everyone can lead a life and really experience their maximum and optimal health potential.
Health equity means to me that we have achieved a society in which everyone, regardless of their social circumstances, their social group membership, can live to their absolute full, realize their fullest potential and thrive.
It's my life's work. It's the whole reason why I do the work that I do. Opening Health Connections Incorporated specifically was to fill gaps in the ecosystem of healthcare delivery in Milwaukee. And so health equity and achieving healthcare access and equity is just at the base and at the core of every decision I make as far as business is concerned. So it's everything.
I look at it as a way of treating people through humanity. When you begin to really treat people the way they should be in every aspect, whether it's economically, mentally, medically, every aspect of it, that brings equity, because when you treat people with humanity, you don't see the differences. You see them as one.
Important for moving things forward is to have a common agenda, to have a critical mass of people on the same page so we know where we're headed. And often we hear people call out for that. What's the agenda? What's the community's agenda?
The community change agenda is a document formulated out of a conversation that we had as the MKE Black Grassroots Network to figure out what are the priorities for Black Milwaukee. What are the things that we consider the most important, that we should focus on, that we should put investment into, and that we should present to the community as a plan. We have a very specific problem here with racism, with oppressive systems and things of this nature, and those are conversations of liberation. How do we get out of that? How do we beat those systems? How do we change those systems?
The elevation and prioritization of Blacks in the city and county of Milwaukee take center stage in the community change agenda.
A community change agenda calls for big policy change and systemic change to address the underlying structural drivers of social and health inequities in Milwaukee.
Things as it relates to the Black community on several levels: social justice, healing justice, system change, Black liberation, and also allowing things to be addressed through the Black lens.
They see this as a priority, this is something that really engages their being, and then ask the questions, how can I plug into this agenda? How can I learn more about this agenda? Certainly coming out to our event and learning about it will create other opportunities.
It is important for Black families and communities to embrace this change agenda because, one, again, we have to do something different than what we have been doing.
It's important for the families and community of Milwaukee to embrace the community change agenda because it's the map by which we need to move forward. We must do this together. We must do this in a way where we use all of our talents together, and that when you come to the table, you understand, like, what are we looking for, what are we going, and so you can see it because it's already laid out so beautifully for you.
We need to hear what you need in your community, what resources, what are the needs of your family and businesses in that community in order for us to thrive.